Okay, welcome everybody. I'm Sharon Anderson, president of Leiomyosarcoma Support and Direct Research Foundation, or LMSDR for short. And I'm really happy to welcome today two guests, Dr. Elizabeth Lager and Jennifer Hamilton, both from Fred Hutch Sarcoma Survivorship Program. So, doctors, could you tell us a little bit more about yourself and your program?
Sure. Should I go first?
Sure.
My name is Jenny Hamilton. I'm a physician assistant. I work at Fred Hutch and University of Washington. I work in the orthopedic oncology group, and so it's the sarcoma program, and me specifically, I work with the surgeons who take care of the bone and soft tissue sarcomas of the extremities.
Okay, how about you, Dr. Lagers?
Hi, I'm Elizabeth Lagers. I'm a medical oncologist by training. I'm the clinical research director for the sarcoma clinic, and I work with patients who could have sarcoma anywhere in their body and work in partnership with our surgeons, including our orthopedic surgeons and our radiation oncologists. And I'm here to just be a good partner to Jenny, who is really our shining star in our clinic and in our survivorship clinic specifically. And so I'm thrilled that she's going to share some of the wonderful work that she's been doing.
Oh, great. Okay, Jenny, do you want to tell us about the program?
Okay, sure. I will share my, let me get my things ready.
Your slides.
Share my slides.
Do y'all see a lot of leiomyosarcoma in your program?
Yeah, we absolutely do. I'll talk, Jenny, while you're getting your slides up because I know you're working hard to get that done. We absolutely do. We have a large program. We are a referral center for the WWAMI region, which is, Washington, Wyoming, Idaho, Alaska, Hawaii, basically that kind of region. We see also some of the folks from Oregon, but some of those folks will go to OHSU as well. So big program. We have 3 orthopedic surgeons, 2 general, intra-abdominal retroperitoneal surgeons, 3 radiation oncologists, et cetera, et cetera. So leiomyosarcoma is one of the more common of this very rare disease, subtypes. And so see a ton of leiomyosarcoma.
Yeah, thank you. Jenny?
Okay. Are you seeing the slide?
Yes, we are.
Okay, good. So this is
just wanted to say that we are seeing your presenter mode
you
as
are?
opposed to just the slide itself.
All right. Let me try this.
There
we go.
Okay. So this is just the title slide. Talking today about sarcoma survivorship, navigating your life beyond sarcoma. And then Dr. Lagers and I already introduced ourselves. We're going to talk about these things today. We'll start with an overview of survivorship and some definitions. We'll talk about what our survivorship clinic is and what a sarcoma survivorship clinic visit looks like. Dr. Lagers will talk about some of the late effects of leiomyosarcoma treatment. And then after that, we'll talk about what happens after a survivorship visit. And then I have some resources and contact information to share.
Wonderful.
Let's see. Okay, so what does survivorship mean? We can start with a definition by the American Cancer Society. The American Cancer Society defines a cancer survivor as anyone who has ever been diagnosed with a cancer, no matter where they are in the course of their disease. So anytime from diagnosis to the end of life, you're a cancer survivor. This includes people living with their disease. So sarcoma survivorship, I like to think of survivorship as any number of experiences that you might have as a cancer survivor or as a patient with or after your treatment for your disease. So survivorship can be thought of as a roadmap for your journey from transitioning from treatment into your follow-up phase. The cancer journey can be divided into three phases. So you have your diagnosis phase and then treatment phase. And then after treatment's done, you're in follow-up. So the follow-up phase can really be many, many years. And so the survivorship kind of encompasses all the things that you can experience after your treatment is finished. So our survivorship program is a 1-hour visit with your team provider, and for us that is your nurse practitioner or a physician assistant who has kind of been with you through your diagnosis and treatment phase. And we also will be involved with your follow-up as well. So the survivorship visit is a one-time 1-hour visit where we address your ongoing concerns. And then we go over your treatment summary and then prepare a survivorship care plan. And I'll explain those components here in a little bit. So how is a sarcoma survivorship clinic unique? It is unique because many cancer centers do provide a survivorship program for cancer patients in general. And a lot of the cancer centers also provide a disease-specific survivorship program for common cancers like colon cancer, breast cancer. But we created this sarcoma-specific survivorship program to address the unique needs of sarcoma patients. Obviously, there are many types of sarcomas, and there are also many types of experience that people can have during their treatment for sarcoma. So we developed this as a way to address those individual needs. And provide resources that can help patients, especially after experiencing a rare type of cancer. So there are many, many topics we can discuss in a survivorship visit, and I like to focus on what the patient is dealing with, what they may have questions about, and what they are concerned about. Transitioning from treatment into follow-up can be somewhat daunting, and sometimes patients are just very worried about that kind of waiting and doing their scans and anticipating those follow-up visits. So fear of recurrence and uncertainty is very, very common. Probably the most common of these topics that we talk about in the survivorship visits. We also can talk about anxiety, depression, trauma experience that can sometimes be a part of the cancer journey, and distress, cardiovascular risk, cognitive issues that people might be having after chemotherapy, fatigue, lymphedema and swelling, pain, nerve pain, sleep disturbance, and then any infection concerns and talking about immunizations for prevention. Additional topics are talking about secondary cancers and screenings that we would recommend to watch out for any other early signs of any cancers or other problems that can be caught early and treated. Employment, disability, and financial concerns are sometimes and issues for patients. Fertility, depending on the age of treatment and whether patients are looking to do some family planning, starting family. Hormone-related symptoms, sexuality and intimacy concerns. A lot of patients have questions about nutrition and should they take supplements after cancer treatment, so we can talk about that. Physical activity and returning to active life and healthy lifestyle. A lot of times after cancer treatment, patients are looking to kind of reset and try to do things as healthy as they can to minimize their risk of cancer coming back, and also just to be healthy, as healthy as possible. So it's a good time to talk about all those things. So I talked about the survivorship treatment summary, and this is basically a brief medical document, like a 1.5 page summary of your treatment, including all those diagnosis details, your biopsy, the dates of everything, chemotherapy, radiation, surgery, which of those treatments you had, or even all of them, and the dates. And this includes the names of all the people on your care team, and any complications or delays in treatment. That's all included in the treatment summary. And then a survivorship care plan it will include, one of the components that it includes is the surveillance schedule and the plan for watching and monitoring for any signs of recurrence or metastatic disease. This happens at regular intervals, and so that's included in the care plan. Any recommendations that can guide you on your journey, things that come up during those discussion of those topics from the previous slide. We can make recommendations, make referrals, provide you with resources to understand more and to manage your journey going forward. We might provide some recommendations for additional screenings or additional testing. And then we do encourage you to reestablish with your PCP or your primary care provider after the end of treatment. This is Dr. Lager's section.
Thank you so much. And I just wanted to mention that this is just an example of the way that we can represent what might be seen in a survivorship clinic visit. So this is by no means comprehensive, but I just wanted to give people a sense of, in greater detail, what we're talking about. So, for example, when you're thinking about long-term or late effects of treatment, you might think about presenting this to an individual based on what therapies they received. So you might have, surgery listed, radiation, chemotherapy. You might specifically look at the agents that they received when they got their chemotherapy, or you might look at the body systems that you're expecting might have been affected by the treatment. So in this case, what I'm representing is just what the late effects are that we might be concerned about. And these are just, again, this is not comprehensive. You saw much more comprehensive lists in what Jenny was describing, but I just wanted to pull out the things that we often will be speaking with sarcoma patients broadly about, and then specifically leiomyosarcoma. And the reason why these things pertain to leiomyosarcoma potentially more specifically is that our patients often are receiving a chemotherapy called doxorubicin, and that's an anthracycline. So that's in that first upper line where we talk about cardiomyopathy or negative effects on the heart, and you see it says high risk and then has anthracycline. So doxorubicin and epirubicin would be examples of that kind of chemotherapy. Our patients also, though, receive ifosfamide and cyclophosphamide potentially, or dacarbazine, temozolomide, platinums like, cisplatin, carboplatin, gemcitabine, or you'll see in the second cancers section, the last row, the epipodophylotoxins, and that is, for example, etoposide. So taking you back to the late effects, cardiomyopathy or negative heart effects like reduced ejection fraction could be a concern for individuals who've received doxorubicin or radiation to the chest where it might affect the heart. And for those individuals, we would recommend a history and physical annually. And the guidelines, especially those guidelines that have been developed for young people, like children or adolescents or young adults who've received chemotherapy for sarcoma, often will be very specific about recommendations, for example, for like an echo at 2-year intervals. So that's the ultrasound of the heart that tells us how well the heart is beating. Infertility can also be a common concern around late effects, and that can be as a result of the chemotherapy agents again, or it can be because you've had to have radiation to your pelvis, and that radiation may capture the ovaries or the testes, or you may have had to have a surgery if you're, for example, if your leiomyosarcoma was in your abdomen, or your retroperitoneum and involved the ovaries. And in those cases, it's sort of interesting. It's a very different kind of late effect, and our best interventions are really around prevention. So that's talking with somebody when they first present with their sarcoma, to help them understand that that infertility is a risk of the treatments that they're going to receive, and then helping them potentially preserve egg, sperm, or ovary. Or embryos, and then also protecting the ovaries during radiation or surgery. And then secondary cancers, what that means is that you will have potentially received successful treatment for the current sarcoma, but then in the future, you might develop another cancer. And that could be another sarcoma. And we often, for example, would call that like a radiation-associated sarcoma. Or it could be a completely different kind of cancer, like a blood cancer, either what's called a myelodysplastic syndrome of the blood, or leukemia, for example. And that can happen, because of the chemotherapy or because of radiation. And interestingly, for that as a secondary, or late effect, there isn't any perfect screening. And that's one of the difficult things about this. If somebody were to have a symptom that might suggest a secondary cancer, like fatigue or easy bruising, nosebleeds, we might go on to get a CBC to look at the blood, and then that might prompt, for example, a bone marrow biopsy or something like that. So again, I just wanted to give an example, a more granular example of some of the things that we might be thinking about, especially in relationship to the kinds of treatments that our leiomyosarcoma patients might be receiving. And happy to, take questions at the end about this if there are any.
Okay, shall we move on? Okay, so what happens after a survivorship visit? We will prepare a treatment summary and a care plan, and then you will receive a copy of that. And then I like to also include, resources that come up from our discussion, anything that you might be looking for additional information. We can include that in the treatment summary and care plan. Those documents are shared with you and your care team. So that includes your oncology care team and then your primary care provider. And if you have other specialists or other providers, we can share that if patients want. We do have the option of a nutrition visit separately from the survivorship visit. And that is something that we do at the Fred Hutch if patients have questions about nutrition or supplements. And then we will also continue your surveillance, so your scans and your tumor follow-up visits, and we will also kind of update your survivorship care plan along the way. Then there were some resources I thought might be interesting to share. You can look at our webpage on fredhutch.org, and if you search the Sarcoma Survivorship, you can see our webpage there. The Fred Hutch General Survivorship Program has some patient education events. They're not sarcoma specific, but they are really good in-person events for learning more about some of the survivorship topics. So you can look at that on the Fred Hutch website, fredhutch.org, and you can search survivorship events and education. The survivorship or the Fred Hutch nutrition program also has an online cookbook with a lot of healthy recipes, and you can search by different dietary considerations. So patients during treatment and after treatment can kind of look that over. Some very healthy recipes on there. Some other survivorship resources, the National Comprehensive Cancer Network, or NCCN, has an online booklet for patients on survivorship. And that booklet does include a lot of those topics that come up during a survivorship visit. You can go to nccn.org and then search for, there's resources for patients, and the booklet is called Survivorship Care for Cancer-Related Late and Long-Term Effects. The American College of Sports Medicine has a program called Moving Through Cancer, and they have a survivorship section. So that can be found on exerciseismedicine.org. And you can search Moving Through Cancer, and then there's a survivorship section there. It's handy because sometimes patients have been not very active or out of their exercise routine during treatment, or maybe never even really had a regular exercise program. And if they want to start that, it has some guidelines on how much you should aim for and how to kind of advance as you're able to. The NCCS, or the National Coalition for Cancer Survivorship, nccs.org, has some other survivorship resources for patients and healthcare providers. And they have a YouTube channel, and they do upload webinars and programs maybe once a month. They also have some podcasts that you can find, and they're not brand new, but they do cover a lot of those topics that are common amongst a lot of cancer patients, cancer survivors. If you have questions for us about our program, you can email survivor@fredhutch.org. And if you have a sarcoma specific question, just mention that in the email and they'll get a message over to us. And that's all.
That's wonderful. I have a first question. What don't you do? That is so comprehensive, really.
Yeah, I mean, we just, we will talk about whatever patients need, and we would try to help them with resources. There's so many experiences that patients can have and undergo. So it's nice to kind of see where they are and see where it goes when we get together and have these visits.
So people, you can write questions in the chat, or you can just unmute yourself and raise your hand and we'll call on you, or you can just blurt it out too. So one of the questions I have is, what is the role of the oncologist when you're in a survivorship program? I mean,
Well,
are you still seeing them or?
Oh yeah. Well, the survivorship visit, the 1 hour visit, is being done by the APPs, by the nurse practitioners or physician assistants. And we work very closely with the oncologist, the surgical oncologist and the medical oncologist. And, if there's a question that comes up that I can't answer during one of those visits, then I'll, reach out to Dr. Loggers or one of the oncologists to provide a specific recommendation for the patient based on their individual situation. But the survivorship program is an APP-led effort.
Okay.
We work really closely, all of us as a team, though.
All right. So Stacy asked, does it cost anything?
The survivorship visit is billed as a medical visit. Insurance pays for it. Well, to the extent that it pays for, whatever medical visits they have, but it's basically it's a medical consultation.
Okay. Yeah, and then is this similar to palliative care or very different from that?
I can answer that one because I am also trained in palliative medicine. So uh, I would say that some of the things that are similar about it is the perspective of approaching the person as a whole person. You know that you are, you know, you were a whole person before the diagnosis. You're a whole person through the entire process. And but I think that the slight difference here is that in the way that our survivorship clinic runs, there is a greater expectation that you are maybe have completed active therapy for your cancer. For example, um, y- while the definition of a survivor is from diagnosis forward, um, it can be helpful to kind of review all this information anywhere along the line, but I think it also is really helpful when you are returning back to your relationship with your primary care provider, for example, right? You know, that sometimes the primary care providers are very actively involved and sometimes they are not. Similarly, on the palliative care side, you can be seen at any time in a serious illness. Um, uh, and it doesn't really matter whether treatment has stopped or started. It doesn't, so I think that the care plans are really helpful in those transitions in care. If you're moving from, out, for example, spending less time at the Fred Hutch getting cancer treatment and maybe spending more time with your primary care or other kinds of specialists. I think that's a very important time to make sure that you do it so that that document can be generated and shared. But I wonder if that's what you would have said, Jenny.
Yeah, I think it fits nicely together. A lot of those supportive resources can be similar, from a palliative standpoint or a survivorship standpoint. Yeah.
We have another question. Can you be seen at the Hutch for this program if you are seen with a different provider outside of the Hutch?
For what we have started doing, if a patient who's not been treated at Fred Hutch wants a survivorship visit and they reach out about that, we have been having them seen at the general survivorship program. So they have a very robust survivorship program at Fred Hutch. And the ones that we're seeing in the sarcoma survivorship program, they're the ones that we've treated in our program. So unless for some reason they are transferring over for their surveillance and care going forward, then we could consider that with me or my team. But if you're not a Fred Hutch patient and you want a survivorship visit, that can be done, but it would be done in the general survivorship program.
Okay. Let's see. Can you describe what palliative care usually entails?
Sure. If it's okay, I'm just going to first say, though, again, that this survivorship clinic is a completely separate program from palliative care. So I think we may be getting some of these questions because I know my title on the slide said medical director for palliative care. That is also a role that I play at the Fred Hutch.
Advantage of you is
Yeah. And so I'm happy to answer these questions, but I just want to make clear that Jenny is, as she mentioned, she's a sarcoma clinician who is also trained actively in survivorship care. And and the palliative care team is a completely separate team. It's completely separate people trained in palliative care. And palliative care generally entails, like I said, meeting any individual who has a serious illness and their chosen, support system. Palliative care focuses on a few key domains. The first is quality of life and symptom management. So we are, as is Jenny, really focused on trying to make sure that you're feeling as well as you can. But palliative care will also go on to help people who might be facing serious decisions about their care for their active cancer treatment, like, should I do this or not? Should I, should I, how can I convey how the treatment is affecting my quality of life or my activity, that kind of thing. They might also want to talk about advanced care planning. So if my disease gets worse, what would be important to me? We also try to support the family and in fact the care team who's the primary oncology team, because they also can have a lot of stress around taking care of people with serious illness. So the palliative care role, especially at Fred Hutch, is much more focused on people who are in active treatment, who are who like I said, may have symptoms, serious decision making that they they want to talk with someone else about, anticipatory guidance around, their illness, whether it gets better or whether it gets worse, that kind of thing. I hope that helps.
That does. Do you need a referral to your program, to the survivorship program?
If you are not already a Fred Hutch patient, you would need a referral, but I guess the referral depends on your insurance. Some patients can self-refer. So we do see patients that way, either as a second opinion during or after sarcoma treatment. Sometimes patients will come through our sarcoma clinic that way. But like I said, for the survivorship component, if you're not a Fred Hutch patient, then we'd have you seen in the general survivorship program.
And what if you are a Fred Hutch client?
Then you could just ask for a survivorship visit. The schedulers can do that. The schedulers can let us know. It takes us about a month to prepare that treatment summary. So we schedule those kind of a month out. But if you mention it to your care team, we'll make sure that we can do that.
Okay, great. Any more questions, folks? You've been doing really well putting them in the chat. I've been reading them. Any more questions? See, you covered it so well. They don't have any questions. How many people are in your sarcoma survivorship program?
So far, we have about 40, a little more than 40. We've seen.
A lot.
So we started a few years ago, and we've been building, but things go up and down. So it hasn't gotten to where every patient is getting a survivorship visit at the end of their treatment. But that's my hope, that we can offer that to everybody.
Okay. What percentage of sarcoma patients get secondary cancers? Maybe you don't have the stat, but
Yeah, well, so it actually depends on what you've what treatment you've received. So for example, I mentioned on that slide the high dose, chemotherapy. People who receive the higher doses of chemotherapy are at greater risk. People who receive higher doses of treatment-related radiation are at higher risk. And it depends on the time frame. So for example, people who have a genetic predisposition for cancer are going to more likely have a second cancer happen more quickly. So for example, they might have this, if it's going to appear in 2 to 3 years after their treatment, whereas the average person is going to have that second cancer, if it does happen, potentially 10, 15, 20 years after, their original treatment. And so that's why this is so important for kids, for pediatric cases, young adult, because they might be, for example, in their 30s or 40s or something like that when this develops. And that's why the screening can be very important. So again, the likelihood that it is going to happen really depends on the treatment that you had. And like I said, if, for example, if you had chemotherapy and radiation to the chest, simultaneously, or, at high doses, that can actually increase the risk as well. It's
What
a
kind of,
rare event though, is what, I think we should.
that's good to know.
Yeah, I think we should know that, it's in general a rare event. In the highest risk groups, it happens, for example, somewhere between 8 to 10% of the time.
Okay.
But that's in the highest risk group, and everybody else is less likely to have these things happen.
Okay. I wanted to ask what you listed what kind of topics you might have to address with patients. What do you see the most of? You had neuropathy, you had chemo, cognitive issues, you had what do you besides the anxiety, because we all know that's number one. What do you usually spend the most time discussing with patients?
A lot of times pain, we could talk about pain for the whole time, a lot of times. Lymphedema,
Fatigue, I think.
yeah, fatigue, sleep, those things can be complicated because sometimes patients are not sleeping because they're anxious and they're up at night worrying, or they they might have sleep apnea or things, just we can spend some time talking about why they might be having the anxiety or the sleep, or maybe the sleep is related to the anxiety, and then talk about if they need to see someone else. I've sent patients after the survivorship visit, I've sent them to the sleep medicine program just to have that looked at and to see if there's a structural reason why they're not sleeping, that kind of thing. Fatigue is a big one, and that also can be related to stress or
Right, right, and depression. Yeah.
them worrying, just worrying and worrying about the cancer coming back, that can just take a toll. So we talk about, is this related to your chemotherapy? Is this how you felt during the chemotherapy, or different kind of energy? Or is it nutrition related? I had one patient who she wanted to do the nutrition visit, so we did the vitamin D level and then sent her to nutrition, and her vitamin D was so low that once she corrected that, she had improvement in her pain that she was having in her surgical site, and then also like her sleep and mood, and a lot of things improved just from correcting her vitamin D level, which was really low. So
That's wonderful. Yeah.
yeah.
So let's see. Stacy asks, do you see that lots of CT scans can put you at risk for other cancers? Should we be concerned about the frequency? Some of us we glow in the dark.
Yeah.
We hear this
It's a
concern.
common question, very common question. So yeah, if Dr. Loggers, if you have other thoughts, but usually I tell patients that we are concerned about that possibility. We do those CT scans so that we can detect an early site of disease and potentially change treatment, change course, and and save your life. We don't do more scans than what we feel is necessary based on our guidelines. And we do constantly want to talk about that with patients and talk about their concerns with that. But after you've had a sarcoma, your risk of potentially that showing up in your lungs or somewhere in your body the risk is pretty high. So we do think that doing the scan is beneficial so that we can catch that early.
Yeah, I always heard the risk of it recurring is more important than the risk of getting a secondary cancer, or is less likely. You're less likely to get a secondary cancer from the CT scan, and it's so vital to catch things as soon as possible. So,
And I just always try to remind people that we are always being exposed to radiation, right? If you live in Colorado, if you take a cross country or, an international flight, and in fact, you are actually being exposed to, a similar amount of radiation. The difference is that the CT does that in such a short period of time, right? It's in minutes or seconds or, but I think what Jenny said is exactly right, is that this is especially during treatment. We're actively assessing the disease and the response to therapy, and those scans are really an incredibly important way to do that. And so we try to to always minimize it as much as we can, but also keeping in mind that the likelihood that you have a cancer from a CT scan, or or a collection of CT scans over time, is much less than the for virtually everyone, than the risk that that the sarcoma comes back. So we want to balance. We want to keep mindful of the risks. The true risks. Yeah.
Yeah. So there's a lot of people on here who do not live in Seattle. Do other major sarcoma programs have a survivorship program, or is this common or not so common, or?
I think we might be the only sarcoma-specific survivorship program out there. There was one in Michigan that I don't think is still running, but there was one. So we consulted with that team. But as far as I'm aware, this is the only sarcoma-specific one. But major cancer centers generally do have a survivorship program. So you could certainly ask about that if you're followed at another cancer center.
Yeah, because it sounds like you offer so much. It's wonderful,
Mhm.
right? Yeah, so something you can talk to instead of having to make an appointment with your oncologist, you could talk to like the nurse practitioners or um, the doctors in the survivorship program instead.
Mhm.
Yeah. Okay, anybody else have questions? You can unmute and ask or put it in the chat. Okay, I think we're good. Well, I want to thank you for your time. This was very informative, and I certainly learned a lot. I didn't know anything about survivorship programs. So this is wonderful. Now I got to advocate to get one in my cancer center.
Yeah.
And people
Absolutely.
are saying thank you in the chat. They're saying how wonderful this was and how informative it was. So kudos to you.
Thank you so much. Thanks for
Welcome.
inviting us.
Thank you
Thank
so
you.
much. Yeah.
Thank you very, very much. Okay,
And hi to
everybody,
Susie.
goodbye.
Thank you.
Bye.